An intracardiac defibrillator, or an ICD, is a device similar to a pacemaker, which is placed underneath the skin, and then wires are extended down into the heart to monitor the heart on a continuous basis. This is particularly important for patients who are at risk for lethal arrhythmias such as ventricular tachycardia or ventricular fibrillation, because when these arrhythmias occur, they immediately stop the heart and cause sudden death. The only way to rescue them would be to shock the heart to get it beating normally. And the defibrillator is a device that does it automatically within 10 to 15 seconds of such an event occurring, which would mean a difference between life and death for most patients having this problem. An intracardiac defibrillator can be put in for one of two reasons: either for patients who have suffered a sudden cardiac event, or for patients who are at very high risk for sudden cardiac death event. So patients who have high risk for sudden cardiac death events are patients who primarily have other heart problems such as prior history of heart attacks or heart disease, and particularly those patients who have heart failure. If their ejection fraction or the heart's pumping capacity is less than 35%, they have a 35% chance of dying from a lethal arrhythmia such as ventricular tachycardia or ventricular fibrillation, which stops their heart suddenly. In these situations, having this life-saving device already on your person allows the device to kick in and get the heart started back normally, because most of these patients, when these events occur, are not going to happen in front of an emergency room or a paramedic station. These things occur while they're watching TV, and people mostly think that, oh, they just dozed off, but in fact their heart has stopped. If they have a defibrillator in, the defibrillator would kick in and they would be brought back to life instantaneously.